get deeper and deeper, and they start moving down the teeth. Eventually, the supporting structure is lost, and the teeth become loose, and they fall out. So gum disease leads to loss of teeth. Cavities can lead to loss of teeth if they are not treated. Statistics show that 3 out of 4 adults have some form of gum disease. It could be in the early stage, it could be gingivitis, it could be early gum disease, moderate, severe. But 3 out of 4 have some type of gum disease. So that just tells you how important it is to get your regular checkups and get treatment as needed. Okay, now I'm going to talk about maintaining a healthy mouth. Proper oral hygiene consists of brushing the teeth at least twice a day and flossing daily. We should always, and I emphasize always, use a soft toothbrush. A medium and a hard toothbrush is too hard and abrasive on the teeth and the gums. The other thing is the toothpaste must be a fluoride toothpaste. It really doesn't matter whether it's Crest, Colgate, Oral-B, it must be a fluoride toothpaste. And I tell my patients that it's best to use a toothpaste, a fluoride toothpaste that says ADA accepted on the box, because we know it has proven itself. It's been tested by the American Dental Association. When we brush, the proper brushing technique is to hold the bristles against the gums, push it up against the gums, and make small circles around the tooth. Brushing like that is a no-no. That is wrong brushing technique. So you hold it at an angle to the top teeth and you make small circles. Hold it down here, make small circles. Or you can do it like this. Don't brush like that. That sawing action is a no-no. What it does, it wears away the enamel on the edges near the gums, and then sensitivity occurs. There is no cavity, but the teeth become very, very sensitive. So make sure and brush properly. Flossing, you're supposed to cut about 18 inches of floss, wrap it around the fingers, and leave just about an inch to an inch and a half out. You pass it between the teeth, and in a sawing motion, move it up and down between the teeth. Then if you go here, you do it against this tooth or against the other tooth, then you pull it out. You go to the next tooth, sawing action, pull out. You have to floss, beg your pardon? Pardon, somebody said something. You have to floss between every teeth and even to the back of the last tooth, because plaque and tartar will accumulate there. Okay, when plaque is not removed consistently, it causes cavities and gum disease. It also causes halitosis, which is bad breath. Okay, as we all know, bad breath can be very offensive to others, and it's a good way to lose friends, because no one wants to be around you. At this point, I would like to address tobacco use and how it's related to dental health. Most people think of smoking as causing lung cancer. Very few people relate smoking and chewing tobacco with oral cancer. Oral cancer tends to occur, the main side of oral cancer tends to be on the tongue. When that occurs, it has serious consequences. The tongue usually has to be cut out in that portion. And when the tongue is cut out, it affects your speech, it affects your eating, it affects your swallow. So, it's a devastating type of disease. When it's cancer of the jawbone has to be removed. And this also produces problems with speech, chewing, and it gives horrible disfiguration. There's a picture up there of a woman who had to have her jawbone removed from cancer. Okay, and feeding tubes have to be placed in order for you to survive. The surgeon, in trying to reconstruct the face, then takes a rib out of your chest and tries to make a jawbone with it. Obviously, this does not look or function as well as your own jaw. Okay, in closing, I would like to say that tooth loss is preventable. You should keep your teeth for as long as possible. Long ago, people thought that as we age, it was natural to lose teeth. That is not the case. This is furthest from the truth that you can get. Proper brushing and flossing, regular dental checkups twice a year are the necessary steps for keeping your teeth for a lifetime and promoting a healthier lifestyle. Thank you.